another fresh episode of Health Wealth by OrissaPostLive. Today we have with us Dr. Pragyan Ku Routray, who is consultant in internal medicine and critical care, to know about the deadly virus spreading over the world, the coronavirus. So let's talk with the doctor and know more about it. Hello sir, welcome to OrissaPostLive.
Thank you so much.
So my first question is, what is exactly coronavirus?
Okay, coronavirus is like any other virus, any other respiratory infective virus. Actually, it started from some animal. There's a theory that probably it has originated from snake actually. So it has come into human beings actually. Now we are transmitting from human beings to human beings. It usually affects mostly your upper respiratory tract like nose, throat and upper respiratory tract. In a severe form, it can go down and cause pneumonia and a severe form. So if you have immunity against it, you can fight it out. If you have less immunity, then there's chance that disease can be more grievous.
What are the symptoms of coronavirus and how are the symptoms different from SARS or other types of influenza?
Unfortunately, the symptoms match very closely with all the respiratory tract infection viruses. Coryza, running nose, itching of the throat, difficulty in swallowing. These are pretty common symptoms in all viral infection affecting upper respiratory tract. Coronavirus also does the same thing, but if it is grievous, if your immune power is not that good, then in the later stage, after 2 to 3 days of illness, it can cause severe cough with expectoration. It can cause severe breathlessness. Even breathlessness so severe the person may land up in ventilator support also. In more severe form, it can affect all the organs of the body like liver, kidney, brain, etc.
What tests are important to diagnose coronavirus?
Yeah, at present we detect the virus in the blood actually, and kits are not available in all centers in India. It is specified available in some centers like Pune and very specified centers in the India. So if we are suspecting coronavirus in some patient, we have to send the serum to the specific lab, and after that they'll give us a report within a span of 24 to 48 hours. But more importantly, as disease progresses, if you have a lot of cases in India, we will be recruiting lot of labs for getting this test done, but blood test is a must.
What are the precautions to stay safe from coronavirus?
Precautions that we should be taking against coronavirus are pretty basic actually. That comes under our basic etiquettes. So how coronavirus transmits amongst human beings is plainly through droplet infection. If somebody is sneezing, that sneezing causes a lot of droplets in the air at a span of around 6 feet. So anybody who is standing within a distance of 6 feet may inhale those droplets and get the infection. Another way out is if those droplets come in contact with some of the objects and you touch that object, again touch your eyes or nose or mouth with the same hand, that can also be transmitted through that. So basically the 2 or 3 things to be done over here. Whenever somebody is having severe infection or chest infection or running nose, better to keep yourself isolated and make sure that you use a good handkerchief and while sneezing, and keep your droplet away from others. And for other person who are in contact with these patients, they should be keeping little bit away from there, and do wash your hands regularly before eating. Avoid touching your eyes, nose and mouth pretty often, and try not to mingle with those persons who are having repeated respiratory tract infection. More importantly, those who are immunocompromised like diabetes, HIV patient or old smokers, children less than 5 years or more than 60 years, they should be little bit more careful whenever you acquire any chest infection during these periods. Sought immediate medical attention.
Thank you so much for guiding us, and we really hope it will be helpful for our viewers. So we heard about coronavirus. Take those precautions and stay safe, stay healthy. If you like this episode, do give it a thumbs up and do not forget to subscribe to OrissaPostLive.